Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, thanks for seeing me today.
Of course, how can I assist you?
I've been having this persistent cough for a few weeks now. I initially thought it was just a cold or something, but it doesn't seem to be getting any better.
I'm sorry to hear that. Can you describe the cough for me?
Yeah, it's quite deep and sometimes produces mucus. It's worse in the morning, and sometimes I feel like I can't catch my breath after a fit of coughing.
That sounds uncomfortable. Are you experiencing any other symptoms along with the cough?
Yes, I've had a low-grade fever on and off, and occasionally I get these chest pains. I also feel fatigued more than usual.
It's important to get a clear picture. How long have you been feeling this way?
The cough started about 3 weeks ago. The fatigue and chest pains began maybe a week after the cough.
Okay. Have you been exposed to any irritants like smoke or chemicals, or been in contact with someone who had similar symptoms recently?
I do have a colleague at work who had a bad cough a few weeks back. As for irritants, not that I'm aware of. Although I do occasionally smoke socially, but I haven't been recently due to feeling unwell.
Got it. Smoking, even occasionally, can make you more susceptible to respiratory issues. Have you experienced any wheezing or felt a tightness in your chest?
Now that you mention it, I do feel a tightness in my chest, especially when I try to take a deep breath, and there's been a slight wheezing sound when I breathe out.
I see. It sounds like it might be bronchitis, which is an inflammation of the bronchial tubes in the lungs. However, we'll need to run some tests to confirm. Do you have any history of respiratory issues?
Not really. I mean, I had asthma as a child, but I haven't had any issues in years.
It's good to know. Asthma can make you more prone to bronchitis. We'll start with a chest X-ray and some basic blood tests. Meanwhile, it's essential to get plenty of rest, drink lots of fluids, and avoid irritants, especially smoking.
Thank you for the advice. I was really getting worried with the lingering symptoms. I just want to get back to my normal self.
I understand your concerns. Once we have the test results, we'll have a clearer picture and can start a proper treatment plan. In the meantime, try to take things easy and avoid any strenuous activities.
Will do. Thanks again for seeing me. I appreciate your help.
You're welcome. Take care, and we'll be in touch once we have the results.
Extract 2, questions 13 to 24. For questions 13 to 24, Complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, Dr. Martinez. Thanks for seeing me today. I've been having some intense abdominal pain lately, mostly in the upper right side.
Hello, Mr. Collins. I'm sorry to hear about your discomfort. Can you describe the nature of the pain? Is it sharp, dull, crampy? And does it come and go, or is it persistent?
It's a sharp, stabbing pain, and it seems to come in waves. It's most intense after I eat a heavy meal.
Thank you for sharing that. Do you also experience any nausea or vomiting associated with the pain?
Yes, I've thrown up a couple of times, especially when the pain was at its worst.
Do you notice any changes in your stool or urine? Like, is your stool clay-colored or has your urine been darker than usual?
Now that you mention it, yes, my stools have been pale and my urine darker. I thought I might just be dehydrated.
Those symptoms can sometimes be associated with gallstones. Have you had any fever or chills?
I felt a bit feverish the other night, but I didn't take my temperature.
All right. And do you have any history of gallstones or gallbladder issues in your family?
Yes, my mother had her gallbladder removed in her 40s.
Thank you for sharing that information. Gallstones are hard particles that develop in the gallbladder, which is a small organ beneath the liver. They can block the flow of bile, which can lead to pain and other symptoms. Based on what you've described, it's possible you may have gallstones.
Is there a specific test you do to confirm it?
Yes, an ultrasound is the most common test to detect gallstones. It uses sound waves to create pictures of the gallbladder, liver, and pancreas. Would you be open to having one?
Definitely. I just want to find out what's causing this pain.
Good decision. We'll arrange for an ultrasound. Meanwhile, it's best to avoid fatty foods as they can trigger pain if gallstones are indeed the issue.
What's the treatment if I do have gallstones?
Treatment can vary. Some people benefit from medications that dissolve gallstones, while others may need surgery to remove the gallbladder. We can discuss the best options once we have a clear diagnosis.
Thank you, Dr. Martinez. I appreciate your thoroughness.
You're welcome, Mr. Collins. We'll get to the bottom of this and ensure you get the care you need.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
All right, we have Mrs. Alvarez scheduled for the anterior lumbar interbody fusion. Are there any concerns regarding her bone density?
Yes, her latest DEXA scan showed signs of osteopenia. This could impact the stability of the fusion. We may need to consider bone grafting.
That's a valid point. Do we also need intraoperative neuromonitoring given the complexity of the case?
I believe so. Given the risk of nerve injury in the region we're operating on, it's a necessary precaution. Plus, she has a history of sciatica, so we should be extra cautious.
Great. And post-op pain management? Considering the procedure, she's bound to have significant discomfort.
We can consider a combination of local anesthetics and opioids, maybe even discuss placing a pain pump for the initial days post-op.
Sounds good. It's imperative we ensure optimal pain control, especially during her initial recovery.
Now look at question 26.
We're moving forward with an ambitious project called the Community Health Vanguard. The goal is to create a more patient-centered approach to healthcare at the grassroots level. This means collaborating with local communities to understand their unique healthcare needs and challenges.
That sounds promising. Are we considering multidisciplinary teams?
Absolutely. Each team will comprise of doctors, nurses, nutritionists, social workers, and even community leaders. The idea is to holistically address not just medical needs, but also social determinants of health, like housing, education, and employment.
That's a comprehensive approach. How do we plan to measure the impact of such an initiative?
We'll be setting up a robust data collection and analysis system. We aim to track health outcomes, patient satisfaction, and even potential reductions in hospital admissions from these communities. It's not just about healthcare provision, but about genuinely uplifting community health standards.
Sounds like a transformative approach. The key will be consistent community engagement and feedback.
Absolutely. This is about co-creating solutions with the community, not for the community.
Now look at question 27.
So how did you feel after the root canal yesterday? Any discomfort?
Surprisingly, it wasn't as bad as I expected. There's a slight pain when I bite down, but other than that, it feels all right.
It's normal to experience some sensitivity after the procedure. I would recommend avoiding hard or crunchy foods for a few days.
That makes sense. I was a bit worried about the swelling, though. Is it normal?
A mild swelling can occur, yes, but if it increases or you notice any unusual discharge, you should contact us immediately.
All right, and when can I resume regular brushing on that side?
You can start gentle brushing from tomorrow, but avoid vigorous rinsing for a couple of days.
Now look at question 28.
How's your range of motion with the left knee since our last session?
It's been better. I can walk longer distances without pain, but stairs are still a challenge.
That's progress, but we need to keep working on strengthening the muscles around the knee. How are the exercises I gave you? Too challenging?
Some days, yes, especially the leg raises. They can be quite painful at times.
Let's modify them then. We want to challenge the muscles, not strain them. Are you applying ice after exercising?
I wasn't, should I?
Yes, icing can help reduce any inflammation. Remember, the key is consistent and gradual progress.
Got it. I'll make a note to ice and keep up with the exercises.
Now look at question 29.
We've seen an increasing need to get direct feedback from our patients about their experiences at our hospital. So we're launching the Patient Voice Portal next month. It's an online platform where patients can log in and provide insights into their treatment, care, and any other observations they might have. They can also opt for a callback if they need a personal touch. Staff can access summarized feedback, allowing them to continually improve patient care. We believe it'll foster a culture of open communication and accountability. There's been a positive response from our pilot test, and we're hoping to see the same enthusiasm hospital-wide.
Now look at question 30.
Dr. Reed referred a 50-year-old female to us. She's been experiencing episodes of chest discomfort on exertion. He's leaning towards a cardiac catheterization to determine if there's any blockage.
Have we considered other non-invasive methods first? Maybe a stress echocardiogram or a coronary CT angiogram?
I did think about the echocardiogram, but aren't the CT angiograms more precise for visualizing coronary artery blockages?
They are, especially in visualizing calcified plaques, but we also have to consider the radiation exposure. Stress echocardiography gives us a functional perspective and is radiation-free.
True, but if the echocardiogram comes back inconclusive, we might still end up doing a cath or CT angiogram.
Right, but it might be worth starting with the less invasive option. If the echocardiogram shows abnormal wall motion, we'll have our answer without further radiation.
Agreed. I'll discuss the options with the patient and let her make an informed decision.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Today we have with us Dr. Amelia Hughes, a leading neurologist with a focus on infectious diseases, particularly meningitis. Dr. Hughes, could you provide us a brief overview of what meningitis is and how you became so deeply involved in this field?
Meningitis is an inflammation of the protective membranes called meninges that cover the brain and spinal cord. The condition can be caused by various pathogens, including bacteria, viruses, fungi, and parasites. The bacterial form, in particular, can be life-threatening if not treated promptly. My interest in this began during my medical residency when I saw the devastating effects of this disease on patients, particularly young children and adolescents. Seeing young, previously healthy individuals become critically ill in such a short span of time left an indelible mark on me.
What are some of the symptoms and challenges faced by those with meningitis?
The symptoms can be quite diverse. Commonly, patients will present with a sudden high fever, severe headache, and a stiff neck, sensitivity to light, confusion, and in later stages, seizures might also occur. The rapid onset and progression of symptoms is one of the major challenges. This means that early diagnosis and intervention are paramount. For patients and their families, it's an emotional roller coaster, watching their loved ones go from being healthy to critically ill within hours.
How can patients and their families cope with such a sudden and severe illness?
Support is essential. Medical professionals should provide clear information about the disease, its progression, and the possible outcomes. Beyond the physical symptoms, the psychological aftermath, including anxiety, depression, and PTSD, can be equally debilitating. Joining support groups and seeking counseling can be tremendously helpful. It's vital to remember that healing is both a physical and emotional journey.
Do your patients often share their feelings and fears with you?
Initially, many are in shock and just trying to grapple with the reality of the situation. However, as time progresses and they begin to process their experiences, they do open up. Many express feelings of vulnerability, fear of relapse, and anxiety about the long-term effects. This underscores the importance of providing a safe space for them to voice their concerns.
How has your approach to treating meningitis patients evolved over the years?
Over the years, I've come to understand the importance of holistic care. While addressing the medical aspects is vital, addressing the emotional and psychological facets is equally critical. I now incorporate a multidisciplinary approach involving not just doctors, but also therapists and counselors, ensuring that our patients get comprehensive care.
Lastly, can you provide some advice on prevention and early detection?
Certainly. Vaccination remains our best defense against many types of meningitis, especially the bacterial forms. Regular hand hygiene, avoiding close contact with sick individuals, and practicing general health precautions can also reduce the risk. Early detection is key, hence it's crucial to seek medical attention immediately if you or someone you know is exhibiting symptoms. Time truly is of the essence when it comes to meningitis.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello, my name is Dr. Alina Symes, and I am here today to discuss an often overlooked but crucial aspect of healthcare, lymphedema. For those unfamiliar with the term, lymphedema is a chronic condition characterized by the swelling of parts of the body, most commonly the arms and legs, due to a buildup of lymph fluid. This buildup is usually the result of a compromised lymphatic system, which plays a critical role in our immunity and fluid balance. Over the past 2 decades as a GP, I've had the opportunity to encounter several patients struggling with lymphedema. One particularly memorable case was a woman in her late 40s. Let's call her Sarah. Sarah had recently undergone breast cancer surgery, during which several lymph nodes were removed. A few months post-surgery, she started noticing an unusual swelling in her arm, which was later diagnosed as lymphedema. This condition is often associated with cancer treatments, as the removal of or damage to lymph nodes during radiation or surgery can restrict the flow of lymph fluid. However, lymphedema can also be hereditary, known as primary lymphedema. Sarah's experience was unfortunately typical of many lymphedema patients. Her swelling was not just a cosmetic issue. It brought with it pain, heaviness, and limited range of motion. She found simple daily tasks, like lifting objects or even writing, increasingly challenging. The skin over her swollen arm became tight, and she began to experience frequent infections, a complication of the stagnant fluid creating a breeding ground for bacteria. What's frustrating for many patients like Sarah is the lack of awareness surrounding lymphedema. Many people, including some healthcare professionals, can dismiss the swelling or attribute it to weight gain or other more common causes. There's a pressing need for more educational resources and specialized training to accurately diagnose and treat this condition. Management of lymphedema is crucial. Once the condition develops, it's typically chronic, but with the right care, its progression can be halted or even reversed. Common treatments include manual lymph drainage, a specialized massage technique to stimulate the flow of lymph, and the use of compression garments to encourage fluid movement. Physical therapy can also be incredibly beneficial, helping patients improve mobility and strength. Sarah, upon her diagnosis, sought treatment from a certified lymphedema therapist. Through a combination of manual lymph drainage and wearing a compression sleeve, she saw significant improvement. She was also educated on skincare to reduce her risk of infections and exercises to help maintain her arm's function. There's a common misconception that lymphedema is purely a physical ailment. However, its emotional toll can't be ignored. Many patients, especially those who develop the condition following cancer treatments, express feelings of frustration, sadness, or even anger. They've already endured the rigors of cancer and now face a lifelong condition requiring constant vigilance. As healthcare professionals, our role extends beyond just physical care. Providing emotional support, counseling, and connecting patients with support groups can significantly improve their overall well-being. In conclusion, lymphedema is a condition that demands more recognition and understanding. By equipping ourselves with knowledge, providing comprehensive care, and offering unwavering support, we can make a significant difference in the lives of those living with this challenging condition. Like every health challenge, understanding and empathy go a long way. Let us not forget that.